In this video, I'm gonna show you how to measure blood pressure. In order to get accurate blood pressure results, it is highly recommended that the patient have no caffeine or nicotine consumption 30 minutes before. The patient must rest at least 5 minutes prior to this activity. We are gonna need a spigonometer and a stethoscope. First of all, we have to make sure the patient has their back supported and both feet on the floor, uncrossed. Now we're gonna use the left arm since this arm is closer to the heart. The hand must be in supinated position at the level of the heart. We are gonna bear the arm, and now we can place the proper cuff in the arm. The artery mark has to be aligned with the brachial artery. Now we're gonna put the stethoscope. The ear tips in the stethoscope must point outside, away from you. Now we place the bell on the brachial artery. Do not place it under the cuff. I'm gonna close the valve by turning it to the right. Once it's closed, we can start pumping to 200 millimeters of mercury. Now we can slowly open the valve and release it at a rate of 2 to 5 millimeters of mercury per second. The first sound is known as systolic, which is the contraction of the heart muscle. The last sound is known as a diastolic, which is when the ventricles fill with blood. A normal blood pressure is when systolic is less than 120 and diastolic is less than 80. Prehypertension is when systolic is 120 to 139 or diastolic is 80 to 89. High blood pressure stage 1 is when systolic is 140 to 159 or diastolic is 90 to 99. High blood pressure stage 2 is when systolic is 160 or higher or diastolic is 100 or higher. Hypertensive crisis is when systolic is higher than 180 or diastolic is higher than 110. In this case, you have to go immediately to the hospital. In this table, we can observe some examples of subjects with normal blood pressure and subjects with prehypertension.